Good afternoon, everyone, and welcome. Minister Haggie will be joining us virtually today, but I'm pleased to have our Chief Medical Officer with us again today. I will now turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have no new positive cases in the province, and our total number remains at 261. In total, we have tested 17,780 people. It has been over a month since our last confirmed case of COVID-19 in our province, and this is no small feat, and one attributable to our collective sustained efforts and determination. But we have not yet seen the last of COVID-19, but let us continue to work together to keep this momentum going. By now, we have all seen the effectiveness of our own personal prevention measures against this virus, and their importance in keeping us safe as we go about our daily routines while living with COVID-19. As we continue to move about and take part in activities we enjoy, it is more important than ever for each of us to do our part. So please stay home if you're feeling unwell, cover coughs and sneezes, practice good hand hygiene, maintain a safe physical distance of at least 2 arms lengths from others while in the workplace and public spaces, and wear a non-medical mask when that's not possible. These simple yet crucial measures will continue to be our best defense against COVID-19 until a vaccine or effective treatment becomes available. Canada Day celebrations tomorrow will no doubt look differently than they have in years gone by, and if you are planning an outdoor gathering to celebrate with family and friends, please do so carefully for your own safety and that of others. We know the greater number of people we interact with, the greater the risk of spread of COVID-19, and physical distancing is pivotal to reducing our risk of contracting the virus. We also know the longer amount of time that we spend together, the greater the risk of infection, and that it is less risky to spend time together outdoors than it is to spend it indoors. So when out and about this summer, please keep in mind people, space, time, place. These 4 words are easy to recall and will serve us well as long as we remember them. I've been seeing a lot of hesitancy and fear, both in the media and on social media, since the provincial government announced the Atlantic bubble last week. These are challenging and uncertain times, and uncertainty breeds fear. There's no doubt of that. But our choices must reflect the science and not our fears. We have trusted the science to get us to where we are today, and we must continue to do so. Special measures orders such as our travel restrictions must be based on evidence and applied in the least restrictive way possible. When we implemented travel restrictions, it was at a time when the rates of disease prevalence were higher in many provinces. In the time since, the prevalence across the country has dropped, particularly in Atlantic Canada. Newfoundland and Labrador's rate is 50 cases per 100,000 population, while Nova Scotia's rate is a little bit higher than ours at 109. Both Prince Edward Island and New Brunswick have lower case rates than our province at 17 and 21 cases per 100,000 people, respectively. In fact, there have only been 2 cases reported in Atlantic Canada in the last week, one from Nova Scotia and one from New Brunswick, and both were travel-related. PEI's last case was April 28th, and this is in a population of over 2.4 million people. So we've been fortunate to keep case counts as low as we have to date. The expectation of 0 cases throughout this pandemic, however, is neither sustainable nor realistic. Our reopening plan is called NL Life with COVID-19, a foundation for living with COVID-19 in Newfoundland and Labrador, and that is our goal, to live safely with COVID-19. We have learned much about this virus since it first appeared in December, both from our own experiences and that of other jurisdictions. We know how to effectively identify cases of the virus. We know the importance of contact tracing and quarantine, and we know how quickly and efficiently it has to be done in order to be effective. We also know how to do this from our own experience with the large funeral home cluster we had early on in the pandemic. We know the importance of protecting vulnerable populations, and we have plans in place to allow us to do that. We know how to reduce spread in healthcare facilities. We know how to reduce risk of travel-related cases. We understand the importance of masks when physical distancing is not possible, and we have a strong, evidence-based surveillance strategy. We can identify which patients will likely need specialized care, and new treatment strategies have recently come to light to help the sickest of those affected by COVID-19. So we are in a very different place than we were in March and even early May, and our health system is prepared. But our biggest weapon in the fight against COVID-19 is you, the public, and your understanding and acceptance of following public health measures. You have been our greatest asset. You have maintained physical distancing, stayed home when you felt unwell, worked from home when possible, washed and washed and washed your hands, and wore masks when you needed to, and trusted the science and public health guidance to inform your choices. And you have made good choices, so please have confidence in what we can do as a province. It is not realistic for our province to stay closed until a vaccine comes along. The realistic objective is that we will live with COVID-19 using our strategies and all that we have learned to identify cases and control outbreaks. That will take a strong public health system and a commitment from each and every one of us to continue to do what we have been doing so well up to now for the foreseeable future. And I know we have it in us. This fight is not over. We are in it for some time to come, but we do not need to live in fear. We have been armed with knowledge, experience, and science. Our decisions and choices must reflect these, not our fears. We have trusted the science to get us here, and it has served us well. I'd like to take this opportunity to talk about some choices that have been made recently in social settings, including bars and nightclubs, which have not really reflected the science. Other jurisdictions have experienced significant outbreaks of COVID-19 related to these settings, particularly if there are large crowds yelling and singing. My intention here is not to single out an industry, as I know most bar owners have been compliant with guidelines and indeed have provided very useful feedback to the public health team. But what I saw from this weekend has made me deeply concerned. Public health measures in these environments have proven effective, so it is imperative that we follow them when out enjoying time with loved ones and friends. Public health officials, occupational health and safety officials, and others will remain vigilant in monitoring these situations to ensure employee and public safety. I know everyone wants to let loose after being pent up for such a long time, but please remember people, space, time, place, and protect yourself and others. This is life with COVID-19, and we must adapt. I would like to provide some clarification on travel across the Labrador-Quebec border. Due to the level of social and economic integration between the communities of Labrador City, Walbush, and Fairmont, and the Labrador Straits area and Blanc-Sablon, asymptomatic individuals who are permanent residents of one of these communities, so you have to be a permanent resident of one of these communities, who cross the Newfoundland and Labrador Quebec border are exempted from the requirement to self-isolate for 14 days when arriving in Newfoundland and Labrador from Quebec. To be exempt from isolation, these people must not have traveled beyond the named communities in the previous 14 days. As well, residents of Lab West cannot travel beyond the boundary of the community of Fairmont or the Mount Wright Mining Complex turnoff at Route 389, and residents of Fairmont cannot travel beyond the community boundaries of Labrador City and Walbush. Residents of the Labrador Straits area cannot travel beyond the community of Blanc-Sablon, and residents of Blanc-Sablon cannot travel beyond the Labrador Straits area. I would like to advise today that in collaboration with the Departments of Health and Community Services and Service NL and Workplace NL, Blue Drop Learning Networks is launching a new online COVID-19 course entitled COVID-19 Work Safe, Best Practices for a Safe Workplace. This 35-minute online course is available to every employee and employer in the province to help create awareness and reduce the risk of spreading COVID-19 in the workplace. The goal of this course, the first of its kind that we are aware of in the country, aims to provide employers and staff with accurate and helpful information that will help instill confidence in staff to work safely, assure employers their staff know how to work safe, and provide public consumers with greater peace of mind. This course is available by visiting myskillspass.com. Every person who completes the training will be issued a WorkSafe e-certificate. A sincere thank you to Blue Drop Learning Networks for spearheading the development of this course. I am certain it will be a great benefit in our province, and I encourage all employers and staff to take the time to complete it. As a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province is 261. We have come a long way in this pandemic, and I'm confident we will see it through. Our hopes are high and our spirit is strong. Tomorrow, as we celebrate what it means to be Canadian, and every day moving forward, let us remember with pride our culture, our heritage, and our tremendous achievements. Wishing you all a safe and happy Canada Day. Thank you.
Thank you, Dr. Fitzgerald, and thank you for those words of advice and confidence. We've officially hit 1 month without a new active case of COVID-19 in Newfoundland and Labrador, and I want to, as Dr. Fitzgerald already added and mentioned and said, that we want to thank everyone for their hard work, their diligence in continuing to follow the public health guidelines. When I get a chance to go outside for a bit or walk into some store, I'm very pleased to see how people are respecting the space of others. People are not only concerned about their own health, but they also respect those around them. I've noticed how quickly people put their hand sanitizers, they take those out. They have wipes readily available once they're either entering or leaving a store. So what that says to me, that people in Newfoundland and Labrador are adjusting. There have been many lessons that we've learned throughout this pandemic, and Dr. Fitzgerald just highlighted many of those. Now, upon reflection, one of those areas is about taking time to learn new ways of doing things, taking time to call someone that you haven't heard from for quite some time, taking time to allow someone in front of you to change lanes, maybe grab an item off of that top shelf in the store without just bursting alongside them. It's about taking time to say hello with a smile as you pass another person. We see that quite a bit in our retail outlets these days. You know that sometimes it's the darkest times in our life that will shine a light on some of the simple things that we sometimes forget about. What I'm talking about is the things that we often take for granted in the past. These are some of the very important things in life. We've been working very well together as we've moved from the different alert levels in our plan NL life with COVID. And we remain committed to working together to support economic and social recovery while ensuring the health and safety of all our residents. On Friday, we will take another gradual step in moving towards the opening of the Atlantic bubble. There have been many questions about this. What we have to remember is that every step that we take is a gradual one. It's a balanced approach. Each decision is made by all of us, our chief medical officer, our public health officials, working together. So lots of questions on how this will work. Essentially, it's all 4 Atlantic provinces that will become one large bubble in regards to travel. And as of July 3rd, residents in all 4 Atlantic provinces will now be permitted to travel to Newfoundland and Labrador, to New Brunswick or Prince Edward Island or Nova Scotia without the requirement to self-isolate. And we look at recent numbers, as has been just mentioned, and looked at as Dr. Fitzgerald just went back over the number of active cases that we would have seen in across Atlantic Canada. You will see that the numbers and the prevalence rate is extremely low. And so there are a number of measures that we've put in place for those with travel exemptions that we've mentioned quite often at this table, or now with those traveling within Atlantic Canada. So let's keep in mind that if someone you know is traveling into Newfoundland and Labrador, 2 pieces of identification will be required to verify the traveler is a resident of one of the Atlantic provinces. And one of those pieces of identification must have their permanent address. Travelers will be met and their identification will be reviewed. Decisions like this are not taken lightly, and they are watched very closely. Dr. Fitzgerald and her colleagues across Atlantic Canada, as well as I've spoken with our premiers as well, have been working closely, and we will monitor this. We must remember that public health travel guidelines will be in place for all visitors from other Atlantic Canadian provinces and territories. Those travelers must adhere to the local entry requirements in place in each of the 4 jurisdictions. As you know, someone outside of Atlantic Canada who plans to travel into Newfoundland and Labrador must self-isolate for 14 days before traveling freely within the province. That includes all Canadian provinces. Last week, I mentioned the possibility of opening travel to other parts of Canada like Ontario, Alberta by July 17th. Now, these are two provinces that we have close family ties with, and over the period of time, our history tells us that many people from those provinces like to visit Newfoundland and Labrador. Now, I want to remind everyone that this date is not a commitment. It's something that we are considering right now. And like everything that we have done to date, movement to reopen will be gradual, it will be balanced, and it will be guided by our public health officials. Science and evidence will be the basis of decisions that we make. We will continue to monitor, we will continue to gauge incubation periods before further travel restrictions are lifted. Lifting further restrictions can only be made possible if we get favorable results in the days and weeks leading up to the July 17 timeframe. Now, like all decisions that we have made, whether it's moving from a new alert level or by lifting restrictions, it can only be done if we maintain good public health measures. By continuing to work together, we can move forward. And we must remember, our actions today will determine the results of tomorrow. As Dr. Fitzgerald said, public health measures and the compliance with Newfoundlanders and Labradorians, that is our best weapon. We will never hesitate to go back if we have to, and the public health state of emergency will stay in place. Sticking with travel, there is a new summer schedule starting tomorrow for a number of provincial ferries. The schedules were developed based on input from the ferry user committees in anticipation of more residents traveling within our province and our staycation this year, our tourism campaign. Ferry services will also be closely monitored and reviewed to help ensure the safety of passengers and crews on all provincial ferries. And this means that all passengers will still be required to remain in their vehicles during crossings. Passengers will continue to be limited to a maximum of 50%. Passengers without vehicles who travel in the passenger lounges will still be required to practice safe physical distancing or at least 6 feet apart from other passengers. And now those without vehicles will not be permitted to travel in lounges unless you can practice safe physical distancing. You can find out more about the ferry schedules by visiting our government website, gov.nl.ca, and of course, say NL 511, this mobile app. That's something that we use quite frequently during the winter, but it's also, you will find ferry information there as well. Now, I too would be remiss if I did not mention the importance tomorrow of July 1st, a day in which many Newfoundlanders and Labradorians mark both Memorial Day and Canada Day. And although many July 1st ceremonies will be taking on a new look this year, like many things that we have celebrated and remembered due to the pandemic. So let us not forget to mark the significance of July 1st in other ways. Similar to what we have done in other areas, let's continue to be creative and find new ways to mark the importance of these special occasions. Perhaps you can visit a war memorial or your community by being physically distant from others. Treat the day as an educational opportunity for our younger generation by visiting different sites and learning about them. You can take a virtual tour of one of the important pieces of our history, and that would be at Beaumont Hamel. You can do this virtually. It's a great educational tool for our younger generation. However you decide to mark Memorial Day, we must remember that July 1st is a time to pay tribute to all our veterans, past, present, in all the conflicts that has represented either Newfoundland and Labrador or Canada, and to truly reflect on the new meaning of service and sacrifice. So I encourage all Newfoundlanders and Labradorians to show your support for our military and our veterans. And I also want to wish everyone a very safe and happy Canada Day. Do it by practicing good social distancing. And for now, I want to turn it over to Minister Haggie for his comments today.
Sure, Premier. Indeed, before I start with my comments, I'd like to say hi to two young friends of mine, Casey and Ava. They would usually be in my office today to see me. They've come every day since 2016, and they're two delightful young ladies who live with arthrogryposis multiplex. Not a common condition, but you wouldn't believe how little it slows them down. Today is World Arthrogryposis Day, and I'll be marking that a little bit later on with a virtual proclamation signing. I don't wear much blue, so if they have one of their T-shirts spare, I'd love to have one. So hi to my two little friends. We're continuing a winning streak here, and a winning streak based on zeros. And again, congratulations to the hard work of Newfoundlanders and Labradorians in getting us to this stage. From my point of view as Health Minister now, while Dr. Fitzgerald and her team continue to keep an eye on the public health elements of things, we have to refocus our efforts now to manage the other impact of COVID-19, which is on the healthcare system itself. Last week, I invited the Newfoundland and Labrador Medical Association in for a virtual face-to-face meeting, in addition to our regular bi-weekly discussions at staff level. And I wanted to talk to them about the subject of backlog and wait lists. Whilst it had been mentioned before, I felt it was important to do that at a fairly senior level. I explained to them that clear direction had been given to the regional health authorities, and the target that was set for them was to work towards 85% bed occupancy for inpatients by July the 6th. Discussions as recently as today with the CEO of Eastern Health suggest that is a stretch, but achievable. And I also invited the Medical Association through their members to let the department know should they be encountering any barriers in reaching those kind of levels or numbers. One of the issues in terms of my vision, not just through COVID, but through the healthcare system in general, is to try and use the capacity we have within the healthcare system more broadly across the province in a more efficient and effective way. And I think by doing that, we will see some significant changes in the medium to long term. But now it's topical because it will help us address the backlog. One of the challenges we have had, and I brought this up with the Medical Association, is that a significant amount of waitlist data actually resides in private offices held by physicians. It's not, as people would generally think, in the hands of the regional health authorities. In some cases, up until just only a couple of weeks before procedures are scheduled. They are going to go back to their members and talk to them about this. But having access to that data will, I think, enable us to do two things. One, in the short term, would be to help the regional health authorities work expanded work week, in the sense of working in the evenings, maybe working at weekends to help address some of the backlog. The other piece, though, would be to look at this from a provincial perspective and to look at giving patients choice for those who could travel if they wanted to move from their local regional centre to one with shorter wait times and better capacity. For example, in the realm of diagnostic imaging, it's not been unusual for patients from Gander, for example, to go to Clarenville or Grand Falls if the wait times there have been excessive in the past, and vice versa. But I think we can formalise this and do a much better job and allow provincial oversight in the sense of having a system that suits the province and not just siloed within a region. They also talked about metrics and about how that would help them from a transparency point of view. And it was actually for us a bit of a light bulb moment when we put together the dashboard for the COVID website. And we all said at the time, we should really do this with the more routine healthcare that you would come across outside of a pandemic. So with the information from the NLMA around wait times with an accurate picture, I would love to work towards the idea of having on the internet readily available wait times by specialty, for example, or by region, maybe even by physician if appropriate. And this would be a great help for primary care practitioners in referral patterns in terms of where you could go for the shortest wait if appropriate. The other element about that is certainly we do collect an awful lot of data for the regional health authorities. We could certainly be putting up volumes there. ER wait times was a thing that I had discussed with the CEO in Central some years ago when she first arrived, as this was the norm in Manitoba. You could log in and see what the wait time was like in your local Category A emergency department. We have a lot of information we send to Ki-Hi about mortality and readmission figures. And whilst we don't need to redo that, we could certainly link to those. And I think it would be a very simple job for the Centre for Health Information to put that together. And I thank the LMA for raising that as something they felt would be valuable because it fits with my kind of prejudices too. The other challenge which we are working on is around the very difficult issues we've had, and I've mentioned this before in that context, which is the long-term care visitation. These have been such a challenge. They are our most vulnerable people, and when I receive the emails or the Facebook messages that I read, I find it a little awkward to separate what is there in other people's minds about the travel, which the Premier and Dr. Fitzgerald have mentioned, and that's for well people who are discretionary and able to travel, as opposed to those people who have to live by virtue of their frailty in long-term care facilities and need extra protection. And indeed, there is a national report by the Royal Society of Canada out today, which I've only just had a chance to dip into, and that makes special reference to protecting residents in long-term care. But there are things we can do, I think, over the course of the next week or so that will enable better access, better interaction safely with family in long-term care facilities. Similarly, we need to look at the ability to relax visitation in acute care facilities too. These are being done with infection prevention and control measures at top of mind. And so, again, that's something that's taking just a little bit longer because of the amount of effort and thought that's required in it, but that should be coming out in the next week or so. So, again, people, space, time, and place. Those are the important words that Dr. Fitzgerald has given you. Memorial Day is indeed a time to reflect, and I would wish all my constituents a thoughtful Memorial Day morning and a happy Canada Day. Memorial Day is a significant time for Newfoundlanders and Labradorians, and it's a little-known fact. The Prime Minister of the Dominion of Newfoundland was actually led into the Hall of Mirrors at Versailles ahead of the Prime Minister of Canada in recognition of Newfoundland's contribution at the Battle of the Somme and later on. I would echo that we have to live with COVID, and I would also like to echo Dr. Fitzgerald's comments about we need to celebrate Memorial Day, but we need to celebrate it with care. COVID will not disappear simply because you've had your second beer. So with that, Premier, I would wish everybody a thoughtful Memorial Day and a happy Canada Day. And I'll hand it back to you, sir.
Thank you, Minister. We will now turn it over to the media for questions for today.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order that they registered for today's call. The first questions today are from Jody Cook of NTV News. Please go ahead.
Good afternoon. On Friday, we did an NTV MQO poll asking residents of this province if they were satisfied with the Atlantic bubble and the idea of us reopening. The Chief Medical Officer, you acknowledged in your preamble that you understand the trepidation and you've seen it with many people not wanting to see this. Our poll suggested 90% of respondents did not want to see the opening. You mentioned a little bit as well about the rationalizing of this, but could you elaborate on that for us, for the general public to understand why our province right now is still not completely open for business by way of services, yet we're opening our borders?
So, as I said, we can't stay, the border measures have to stay in place and have to be put in place in the least restrictive way possible. So it has to be supported by the evidence. Right now, the evidence, given the prevalence in those provinces, doesn't really support us keeping our borders closed because their epidemiology is as good as ours, really. And so, you know, we have to make sure that what we're doing, we're applying the science to it and that we're making good decisions based on that science. The two, opening businesses and making sure that we do that safely and opening borders are not mutually exclusive of each other. They can happen at the same time, and certainly we have opened a lot of businesses, and there are there's not much left to open. So I think we are making progress on both fronts, but we don't have to have one completely finished before another one can happen. There are things that are happening, in tandem with each other. So I think what we've done thoughtfully, and we've applied the science, as I've said. Certainly, we've been generally conservative with the way that we've approached this, and I think that's still been our mantra. So I hope that answers people's questions, and I hope that the fears that people have been feeling about this can somehow be addressed.
Jody, if I could add just a few comments to this too. We've relied on the science and the evidence making these decisions, and there's no question is when you make a decision, people will always ask about this particular service. And as Minister Haggie just mentioned about what about visitation to long-term care, which are really two completely different issues. Around long-term care, which is always I think, the toughest decisions that all of us at this panel would, have had to grapple with. It's very difficult to receive the emails, as the minister just had mentioned, and seeing the situations that families are in. But we also recognize that given where we are with the prevalence of this virus within all 4 Atlantic provinces right now, we're able to safely move around Atlantic Canada. And also when you look at what's happened in other jurisdictions that have made similar decisions, and if you look at Western Canada, what they had seen out there from an increase in travel from one province to another, say BC to Alberta or Alberta to Saskatchewan, the numbers didn't really go up a whole lot. Somewhere around 8% increase is the number that I was given late last week. So we don't expect to see a big spike in travelers in terms of a large increase of numbers coming to our province, but it's gradually and with a balanced approach opening up those borders, make sure that we continue to monitor people that come into our province as well. So it's just part of the reopening plan and making this decision, and we would not make this if we felt that it could not be done safely.
Dr. Fitzgerald, you had indicated that it is not realistic to imagine life without COVID here in Newfoundland and Labrador, and more positive cases are likely. I'd like to ask, is this opening an attempt to allow controlled spread, considering our only experience with a large amount of spread, and that's relative, would have been the college cluster?
No, that's not the purpose. We're certainly not purposely trying to control the spread of this virus through our population. Obviously, we want the least impact of this virus on our population that we can, but we have to do that. We have to take into account other impacts as well. This is, as I said, we have taken a conservative approach, and we would not be recommending this if we didn't feel that at this point it was safe to do. And certainly when we look at the epidemiology elsewhere in Atlantic Canada, we feel that it is safe to do this.
Premier, about 45 minutes ago, the province released its information on the domestic violence helpline becoming available today and now live for calls and texts. Can you tell us a little bit more about that?
Yeah, so over the last few days, and I guess a couple of weeks right now, the decision was made to work with transition houses across the province. They've had considerable experience going back nearly, 3 decades in supporting women within our province. So right now, the ability to actually text, to receive text messages, and also with the new line that's been put in place, making sure that if someone uses this number, 1-888-709 7090. If you use that number, well, then part of the identification that would come up is the region, and they could actually get some support for one of the transition houses that would be closest to you. So it's something that I know the department has been working on for quite some time. I know people were looking for the ability to actually communicate with the text messaging. All of this is important. But I also want to reiterate, too, that services have always been available for people and for women that find themselves in some of those precarious situations. Those services have always been available. This is a way now to enhance and make access a little easier.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi. Minister Haggie, a little while ago you said that the Eastern Health CEO, I believe, that the July 6th goal for 85% capacity in health services was a stretch but achievable. And given that doctors have been giving their section heads, polling their section head and finding less than 50% on average, in most cases, of capacity, do you really believe that can be achieved by July 6th?
The RHAs have had very clear direction, Peter, that's where I would like them to be. How they get there and how rapidly they get there has been left to them. They have their own plans. They're very detailed. They've been shared, in actual fact, and grown with the clinical chiefs in each RHA, the VPs medical, the senior leadership teams in each RHA. And the fact is that there will be differences. We're looking at 85% bed occupancy. The capacity of some of the procedural areas, such as endoscopy, for example, will never be the same now we have COVID. The question is, what level can they return to as infection prevention and control recommendations change in the light of new science? Currently, they are working at around 50% capacity. And over the course of the next little while, we need to work with IPAC and the clinicians and systems engineers to describe a way of adapting to the requirements of PPE and COVID so that we can increase that throughput. But honestly, you're never going to get back to the exact same number that you had before, and that has to be factored in discussions with issues around demand management, issues around how the physicians themselves choose to select tests, and also the resources from the RHA. Each of those is a discussion that we are currently having.
Okay. Just as an example, we heard yesterday that there's a 14-bed ward in Gander that's still closed to anything other than COVID-19. We've only had one case in the past 2 months. Why would that ward still be closed?
These are operational issues. I would direct you for the specifics of that to Central Health. I do know that there are beds that are not yet occupied as a result of a ramp-up in activity. The PPE issue has really softened from our point of view. That was my main concern 2 weeks ago, I think you'll remember. And then last week, there was the announcement that DF Farms and Task Force NL are now capable of making up to 10,000 gowns per week. That's about 5 days' worth of pandemic burn per week that they can account for just locally. And that's going to be a huge relief to the system. And as we get local capacity to get gloves and such. So PPE is not the issue. They, in the RHAs, have a plan to open up those beds as patients are prioritized by clinicians and the ORs and the admitting process ramps up over the next week.
Okay, thank you. I wanted to ask about the Atlantic bubble, but you've talked a lot about that already. I'm curious to know, though, are there any plans, for example, a person from New Brunswick or Nova Scotia can go to a wedding with up to 200 people and then come to this province without isolating? Are there any plans to streamline reopening status between the provinces?
You mean with regard to mass gathering size?
That and other measures, yes.
So right now, each province has, developed their own recommendations with regards to gathering sizes and other reopening parameters. So there's no plans at the moment to combine anything or to align anything any further than what's already been done.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. Dr. Haggie, you talked a little bit at the beginning about the meeting with the NLMA and their concerns, and of course, some of them are saying that OR times must be opened up now before a second wave of COVID-19 arrives, or they'll never catch up. What concerns do you have that a second wave will hit if the backlog is still not fully addressed?
I think the issue of the second wave is hanging over us. Whether it's a wave or a wavelet depends on which set of projections you look at from Public Health Agency of Canada. Our modelling team are having a little difficulty modelling anything on the basis of over a month of zeros. The opportunity now, I think I addressed in my opening comments, it may be to extend the OR working week. Traditionally, that works Monday through Friday and works for essentially a 7-hour day. So if you can add in Saturday list, maybe Sunday list, maybe have evening list, that increases capacity by up to 50%. I think one of the things that we were able to do, which puts us in a better position, is we were one of a very few number of jurisdictions in Canada who were able to continue with urgent and cancer surgery. Not to the volume maybe that some of the clinicians would have hoped, but the facts of the case were Ontario, for example, and Quebec shut down completely. You couldn't even get chemotherapy in those jurisdictions. So we have taken some of the edge off. But the true magnitude of the backlog will only really be known when the NLMA and their membership come back with some of the waitlist data that will help us, because quite frankly, the only people that we know about for sure who are waiting at the RHA and administrative level were that first 2 weeks of cases that were cancelled when the shutters came down right back at the beginning of the pandemic. So this is a work in progress. The RHA is a clear direction. I've asked the NLMA to identify any barriers they encounter, because both the NLMA and I are on the same page here. We want this addressed.
And a follow-up to that as well, doctors are also saying medical procedures may now pose a greater risk to people than the novel coronavirus. What is your response to that?
I'm not sure of the context of that. Certainly what I could say from 30-odd years of clinical practice is there is no treatment that is risk-free, period. The question is as one of my colleagues in Cabinet would say, the juice worth the squeeze, because at the end of the day, most of the time, there is a significant benefit. And as my opposition colleague referenced on VOCM, people don't go for surgery because they're bored and they've nothing else to do. These are serious, life-threatening issues. So there are always risks to surgery. There's a risk to taking a tablet. There's side effects to every medication out there. So at the end of the day, that's a discussion between a patient and their physician about what their goals of treatment are.
Okay. And Premier, Air Canada has recently announced a halt of some interprovincial flights, many of which affect this province, such as Goose Bay to St. John's and Deer Lake to St. John's. How much of an impact will this have on people's plans for staycations and the tourism and hospitality industry that is banking on them?
Well, anytime you hear it from a company like Air Canada that have been traveling those routes for many years, when they make significant changes in routes, which reduces capacity, well, we know that will have an impact. But I've mentioned already that what we would expect with the Atlantic bubble and so on will be a very minimal increase in passengers as well. That's the experience that's happening in Western Canada. So it's unfortunate that what we've been saying for quite some time. It's important that the infrastructure that's in place, that we've been able to take advantage for many years. And as we're seeing through the course of this pandemic, the significant economic impact that it's having on many industries in our province and across the country. This is an example. Here Canada losing over $1 billion, laying off some 20,000 people. These are the economic losses and impacts of this pandemic. Newfoundland and Labrador is seeing this as a result of this announcement today, but we're seeing this nationally. It's just not here in Newfoundland and Labrador. Also added to this is the impact on our airports. We're seeing many of our airports with revenues down by some 97%. And so it's important, as we get into a situation that we can move and travel safely around, as we take measures to allow that to happen. These are the exact types of infrastructure that we talk about that must be in place as we come through this pandemic.
Okay, thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. I want to ask about personal interactions, especially in light of Cancer Day tomorrow. The COVID-19 government website still says people should be sticking to their double bubble plus 6. Dr. Fitzgerald, you said before that people should be focusing on keeping their contacts low, but I know lots of people are wondering if they have friends or family outside of that double bubble plus 6. Can they invite them over for dinner? Can they be increasing some of those interactions with friends and family that they haven't been able to see for months?
So we know that people, as we move through this, people are likely going to increase the number of contacts that they have. And what we're saying is to try to keep those as low as you can outside of your core group of people that you would want, that are in your lives on a regular basis, day to day. So those are the ones you want to keep in your bubble, so to speak, and keep your core group of contacts. But certainly there are going to be some contacts outside of that. There are ways to have interactions with those people and to still do it safely and to have a meaningful and good time with people. My son graduated this past week, and we invited people over for a distanced gathering in our backyard, and it went really well, and people practiced good physical distancing and were safe, but we had lots of great conversation, and it was still a good time. So I think there are things that people can do to interact more with others without going against some of the public health measures that we've recommended. So the goal here is to try to keep your close contacts as low as you can outside of your core group of contacts, your bubble. And knowing that, yes, of course, you are going to have some. There are going to be situations that are going to be unavoidable at work or playing sports or whatever the case, but to try to keep that as low as you can. And when you do have those situations, keep track of it so that you know who you came into contact with, so that you know who your close contacts are, so that when we have to do contact tracing, because it's going to happen, that we're able to do that as quickly and efficiently as possible, and to keep us all safe in the long run.
Next question is about weddings. I heard from lots of brides as well as those within the wedding industry. If you've got a restaurant, for example, that would normally have a 200-person capacity, right now they can serve dinner to 100 people with physical distancing. Why couldn't that same venue have a wedding for 100 people? What's the difference here?
So I think you have to consider about what's happening at these situations. Like restaurants, we certainly, the guidelines that we put in place are for normal operations of a restaurant, and so we're not saying that restaurants should have weddings of 50 people in them. This is for your normal day-to-day operations of a restaurant, so and which would not be considered a mass gathering, so to speak, as opposed to a wedding where you would have people who know each other and things like that. So I guess people can look for differences and to try to find ways around things, but these guidelines are put in place for what seems to be reasonable and reasoned usage, and we hope people will respect that.
And my last question is around exemptions. We did an interview with Heidi Matthews, who's a lawyer originally from Newfoundland and Labrador, living in Toronto. She just had twins. She says she doesn't have family support in Ontario and has been denied a travel exemption in order to come to Newfoundland and Labrador so her parents can help out, even though she's willing to isolate upon arrival. Can you explain why was that decision made?
So I can't speak to every decision that's made in exemptions. We have exemption criteria that are made with regard to how, what constitutes an exemption and what allows someone to be able to come into the province. And there certainly the people who are on that exemption, on the exemption email, certainly follow those guidelines as best they can. They have the information that's been provided to them. What we can say is if someone feels that they don't, that they need to have a reconsideration or they wish to appeal, they feel that they've been, wrongly denied, then they certainly have the opportunity to do that. And that is anyone who's been denied can actually appeal.
Thank you.
And our final questions today are from Patrick Butler of Radio Canada. Please go ahead.
Hello. First question is for the Premier. The Education Minister said earlier this month that there would be a detailed plan for schools reopening in September. Where is that plan? Can you give us any detail?
Well, we would have liked to see this plan out by the end of June, of course. We're probably going to see a few days in the delay of the plan. There's been a lot of work that had to go into this. There was a number of scenarios for the education plan. So we'll be working on that again later today. But I can assure you that we will have a plan in place for the school opening for September this year. It will be detailed, and it will be including, many of the aspects that we'll have to consider. We can safely open our classrooms in September this year, and in case the scenario exists that we cannot safely open classrooms, there will be options there, a number of scenarios that we'll have to consider. So there's a lot of work that went into this, working with the NLTA, working with the English School District and the Francophone District, of course, and the department. So we're almost there. We just need a few days now before we can get this finalized.
And Dr. Fitzgerald, you talked about some of your frustration related to bars reopening. And you also said that public health officials are monitoring what's happening. What tools are you actually at your disposal to enforce things like physical distancing at places like bars? And are you able to levy any penalties or actually take enforcement measures in that scenario?
So the enforcement measures that we have, anything that we can enforce from a public health point of view has to be in the special measures order. So much of what we've put out there have been guidelines, and quite frankly, that has been enough. People have been quite willing to abide by the guidelines, and on the whole, businesses have been quite compliant and welcoming of the guidelines, and that's true for the bar industry as well. I don't have a quarrel with the industry in particular, so I just want to make that clear. But there were some concerns over the weekend. There are also so our enforcement really is about mass gathering size. That's certainly something we can enforce. And there's also occupational health and safety rules that have to be followed, and certainly COVID-19 concerns are a factor into that as well. So these are things that are all going to be monitored to ensure that we have a safe industry and that we don't see the outbreaks here that we have seen in other areas, because that is concerning.
Dr. Fitzgerald, Patrick, is absolutely right. I think when you identify some of the areas of concern, as she did in her opening remarks, I think that's appropriate to always, make those statements and just issue those words of advice and wisdom on how people would interact in certain, businesses. But I will say, for the most part, I think we really need to congratulate those retailers and those businesses that have opened up, and those people that shop and use those services. I mean, if you look back at a retail experience in our province right now to what it was pre-COVID, it is a very different experience. We're seeing people lining up outside because there's limited numbers inside. So I think if we look at, we send the words of wisdom and advice for those that, often or that will sometimes need that. But by in large part, people have made a very significant amount of changes, and we really need to recognize and compliment them for the great work that they've done, and indeed for the people that use and service and become part of that retail environment. They've done a remarkable job, and I want to compliment the work that they've done, recognizing that when we see instances that will need some tuning and some tweaking, we must make them aware of that as well.
And just to follow up on that, when we talk about these instances that were observed over the weekend of bars, what are we actually talking about? When you say that people weren't necessarily respecting the rules, what did bars need to be doing differently, and what were the concerns that you had specifically, Dr. Fitzgerald?
So there were some concerns with regard to crowding, physical distancing, dancing, and just not following some of the guidelines that we had recommended. The biggest concern was the actual capacity in some areas, and it was just, my concern here is really for the health and safety of our population and for the capacity of the healthcare system, and that's really important. And when we see what we have seen in these situations in other jurisdictions, it really struck me as something we had to try to get out ahead of, and to reinforce the importance of safe physical distancing, and that these measures are in place not to make people's lives difficult, but to try to protect people as much as possible. Because just because we have no cases of COVID in the province at the moment does not mean that we are not going to have COVID in this province. Even before the Atlantic bubble, people are still coming into this province every day We need to be vigilant. We need to learn how to live with this. And this is our time to learn how to do that properly. So we don't want to have to close down anything. We want to continue to open. And so we need people to be, to be in line with what the advice is saying.
Thank you.
Thank you very much. The time for questions has ended. Please join us again on Wednesday, July 8th, 8 p.m., 1:30 in most of Labrador. Enjoy your Canada Day, everyone. Bye-bye.